With me now is Erin M. Moss. She's with Erin M. Moss Mental Health Counseling Private Practice. She's a licensed mental health counselor, and she's really one of several guests we're going to talk to over the next couple of Thursdays. Bookmark it, remember it. Every Thursday at 4, we're going to be doing these kind of conversations, and we really want you to be a part of it all. It's part of our mental health initiative funded by the Patrick P. Lee Foundation. We're thankful for their support. We're thankful that you're here. And Erin is ready to answer some of your questions and give us useful information, specifically about anxiety and stress, something that clearly people are thinking a lot about this time of day,
Yeah.
this time of year with COVID out there the way it is. Erin, thanks for being with us.
Thank you for having me.
Tell me a little bit, how has your life as a counselor changed? What kind of issues are people bringing to you? What are you seeing out there in the community?
Yeah, well, a couple weeks ago, my life changed tremendously, like everyone else, I'm sure. I've been running my practice for 4 years now, and I just hit the anniversary, and I'm thinking smooth sailing. And then, pandemic hits, and I had to really reroute everything. I went from seeing all of my clients, probably see about 40 or so people a week. I had to move everyone online. And so that was a task. I had to, inform billing and insurances and make sure everybody had equipment and the ability to be able to do it. But, got it going. Yeah.
What kind of things are they bringing to you? How are they defining stress? What are they
Yeah.
seeing?
Well, everybody is just, I think overall, this feeling of almost like a dreamlike state. Like, I can't believe that this is happening. We're really stuck. I think the first week or so, it was, okay. But now it's really hit that this is our new normal. And so I'm seeing a lot of people worried about what's to come, events, things that they had planned that they're not able to do, but really just the unknown. I'm seeing people that are sluggish, feeling like they don't want to get out of bed, really a lack of energy, motivation to get up and do things because their whole routine has really changed.
Yeah, and that's kind of the depression side of it. That's kind of the stress side of it. Have people coming to you with anxiety? Are they worried? Can they just not shut themselves down or not sleep at night? Talk a little bit about that side of the equation.
Yeah, well, you mentioned stress earlier, and stress is really, more of irritation, maybe, sometimes a physical kind of reaction to, tough circumstances. And everybody can feel stressed. Everybody has felt stress at certain points in their life. Anxiety is when that stress gets so extreme that it's affecting your day-to-day life. You're nervous, you're tense, you're keyed up, you're on edge. And so even if you weren't someone that has generalized anxiety disorder, you could be experiencing anxiety right now with the current state of things.
How can we recognize it, if not in ourselves, in someone around us? What do we say to the wife, the spouse, the kid, the person that we see it in who might not see it in themselves?
Yeah, I would just check in and ask the question, just like we would if somebody was depressed. Are you feeling overwhelmed? Are you feeling stressed? And let the person know that that's okay, that that's normal. You might even share your own experience that, you're feeling it too. The thing is that stress and anxiety can manifest itself in different ways. For someone else, they may be busy doing different things. Another person may be nervous, worried, curled up in a ball, but letting that person know that it's totally okay and that you're there for them to listen or whatever it is that they need. Look for physical signs. It could be nail biting, nervous things, maybe scratching, pacing. And then also look for emotional kind of signs. Maybe the person looks sad. You can tell that their face clearly looks different. So stress manifests itself in different ways.
And I imagine too, you said someone might be just staying in bed all day. To some degree, can we manage stress by managing the expectation? Is it okay if I happen to take a day where I lie in bed?
Yeah, I think that that is okay. A day is different from days. And what are you doing that day? Have you put on your favorite comfy pajamas, and are you watching your favorite movies and eating your favorite foods? That's not so much of depression. It's more so making yourself comfortable and doing what your body needs. When it becomes though something that I'm doing, all the time, that's when we go off into more of a depressed type of state. And we do have to make sure, even in this time, that we're getting up and we're moving.
We're asking people, obviously, on Facebook here to share some of their comments. We just got one that came in. David Mann is asking, basically just commenting, saying that the weather is not helping. Uh, it's April and it snowed today.
I know.
Um, uh, Seriously, though, a darker, drearier day
Yeah.
is going to contribute to depression anyway, regardless of all this COVID stuff that's going on.
Yeah, Dave, I tell you, here in Western New York, if we couldn't have everything that's going on right now. It's a very interesting time to see snowflakes falling, to know the state that we're in right now. I think that sometimes you just have to laugh about things as well. This is definitely a laughable time. But also, though, with everything going on, if you're noticing your mood and things changing and life closing in, that's when you need to reach out to your support system. So even though we can't see each other in person, we have the ability to connect online. Where I'm hearing about, health issues in the past, and it was before we had all this technology. Now at least we can still connect with each other. So you're going to have to make that extra effort to connect with your loved ones if you're starting to feel the impact of all of this.
I know a group of office workers that I'm aware of are actually having virtual happy hours. Some people I know who are not part of an office group are getting together for virtual Sunday brunches each
Mhm.
week. They'll actually put their laptops on the various dining room tables across the region
Uh-huh.
and end up just sharing with each other that way. This is the kind of stuff that can help, no doubt.
Absolutely. Absolutely. I've seen some of those things as well. Some of the DJs are, doing, dance parties from your living room. People are becoming so creative, and I love it. If you're a person, especially that's living alone at home, you want to make sure that you get in some of these online groups, support groups or fun groups alongside connecting with family and friends so that you can maintain that day to day social interaction.
Here's another one that came into us via Facebook before the program started. Someone wrote, they have anxiety about my business. My husband has health issues. I'm not sure if it's safe for me to start my business and financially worth it at this time. At times, I have anxiety attacks and I need to do breathing exercises. What can
Mm,
I do? They ask. I fall into depression. I try to stay active and I get depressed again. It's a
yeah.
horrible cycle, they wrote.
Wow. First of all, thank you so much for writing in. I mean, for allowing us to be able to talk about what's going on in your life. And it's very real. Those are things that are echoed within, a lot of the clients that I'm seeing themes of that, feeling depressed, financial, struggles. And what I have to tell to that person is just to take it easy. There's so many things that are going on. A husband lost job, trying to start my own business. And I think right now we need to just be. I think there's this need inside of us to get up and do and to continue on with life as it has always been, but everything has changed. And sometimes the best thing that we can do is just go with the flow of things. Think about also what it is that you do have. And I know that it's tough sometimes to look for the silver lining, but do you have your family around you? Do you have loved ones that support you? But what is working around you? I love how this person said that they need to do breathing exercises because that is wonderful. And it definitely helps to alleviate stress and anxiety.
I don't want to put you on the spot, but can we do one? Can you demonstrate here? Show me what a breathing exercise looks like.
Absolutely, Dave. If you can just sit upright in your chair. Okay.
All right.
And then try to just relax the shoulders back. And I want each of your palms just lightly on your legs in between like your knee and the beginning of your leg. And then let's take a deep breath in through the nose, and then we're going to exhale out through the mouth. And we're just going to really that out, okay? We'll do that 3 times. And if you're listening along with us, please feel free to do that. Deep breath in.
Oh, wow. I do feel it
Yeah,
like loosening in my
yeah,
back of my,
yeah.
yeah.
Let's do that again. Feel free to even make whatever sound comes out with that. Let's do that again.
I
And
actually,
Dave,
yeah,
if
I feel a
you, yeah,
difference. Things start to
yeah.
relax.
And if you want to take the head around, I do that sometimes in one direction, and then you can go in the opposite, and just kind of alleviate some of that feeling of feeling tense. The body holds stress and anxiety, and that's one of usually our first signs that we're starting to feel that way because we feel achy,
Yeah.
and pains. Yeah, yeah.
There are times at night, and my wife is not going to like the fact I'm telling this story. She has a wooden meat tenderizer. She's never used it for meat.
Like,
It's always in the bedroom, and she'll pound the back of my head or my
uh
shoulders with it, and it just does. You're right. It's like moving the head, it relieves things. What are some other things that people can do? Talk, for example, about the value of routine, making
yeah.
sure that you're doing the same thing each day, you're being regular, and you're kind of reinforcing a sense of normalcy by doing that.
Yeah, routine is so important, even when everything that you know has changed, adapting some type of routine, even in that stage in your life. And so, if you regularly got up, you had your breakfast at 7, you got dressed, you went to work, obviously that's not happening. But maybe you have to log on at 9 a.m. to your work conference call. Do you still get up? Do you still do your breakfast, get your coffee going, get dressed? Whatever it is that your routine is, it's change, but you can still implement forms of that in what it is that you're doing now. Even the things that we do for fun, getting creative with how to continue to do those self-care things that make you feel good.
And you've shared a story before this program started with me. For you, that's your eyebrows.
Oh gosh, yeah, yeah.
It's a great story. Tell us.
Well, I've been getting my eyebrows, they call it threaded, for years now, since like college. And they take a thread and they kind of get all the spare, eyebrow stuff out. And they actually stand over you and do it. You absolutely can't do that now. All that stuff is closed. But I do it religiously. Every 2 weeks, I'm at the eyebrow salon. And so for me, I had to order one of those eyebrow pens that you see on TV and, that you kind of get up on there and shave with the light. And don't get close up on my eyebrows because I'm sure that it looks nothing like what the stylist does, Dave. But it makes me feel good, to still have that peace in my life of something that I do that makes me feel good. And it's something that even in this time of uncertainty that I still have control over.
It creates normalcy. It's something you would have
Uh-huh.
done before COVID. So now it's something you do during COVID, and you feel better about it.
Absolutely. And that's a
Okay.
perfect example of things that you could be doing at home that might look a little bit different, but you're still carrying that on.
I'm looking for examples. I talked a little bit about the meat tenderizer. You talked about the eyebrows. If there are people on Facebook that don't necessarily have a question, but just want to type in and share something that works for them, we'd love to have you give those comments. We are also taking a couple of questions here and there. And this one just came in, Erin. On Facebook, Nancy says, I work at a store that's open to the public. How do you get over the fear of having to go to work and deal with the people that in some cases don't follow the rules? It's scary. I don't want to
Yeah.
get sick and bring it home to my family, she says.
Yeah, wow, that's a great question. And I've been doing counseling with folks that are in healthcare fields and grocery stores and things like that. Real concerns, those essential types of services. So first of all, you absolutely want to make sure that you're wearing, your protective kind of gear. If you're wearing a face mask, your gloves, but the things that you have to make sure that you are doing your part in being safe. Okay. Um, Also, I would encourage you to talk to your supervisor and things about your concerns. As time goes on with this, new things arise. You see in the grocery stores now, and in the convenience stores, they have the screen up. They didn't have
Mhm.
those before. You might discover something that management has not picked up on that they could change, just as far as how close people approach you. Okay. Also, making sure that you take time for yourself. I know that people take smoke breaks and things at times. Can you take a break and do some breathing? Can you take a break and relax yourself? So, one, you need to make sure that you're doing the things that you need to do to protect yourself, that you are safe, feeling comfortable talking to your manager, and taking some time for yourself. Carry those safety precautions also, obviously, when you go home to your family.
The first little nugget of that question was, I'm afraid of going to work.
Yeah.
If they're in the car about to go to work, does that breathing exercise help? What can you do to get over that initial fear? I just don't want to go in today.
Yeah. Well, one, again, it's normal to feel that way, so I don't want to put a cover over everything. It is totally normal to feel that way. We're in a time of complete uncertainty. But I think also it's good to remind yourself that you've been trained in this job, that you can do the work that you're doing. And a lot of the healthcare professionals that I'm talking to, they're feeling those same types of feelings. And I have to remind them that they are equipped to handle these things, that they have trained for this. So if you have attended some type of training, informational, you're talking to your staff, you're coming together with people, I think continuing to remind yourself of the things that you guys have put in place that are there to protect you and people that are there to help you. Now is also, Dave, a time to apply your faith. Whatever it is that's bigger than you, whatever it is that you do in your home or with your family, you want to carry that into work with you, just like you carry your medicine and your protective gear. You need to make sure
Yeah.
that you're applying your faith.
Elizabeth writes in, she says, this is a good time for gardeners, current weather notwithstanding. It's something very positive to do on your own property, and it gets you out of the house safely.
Yeah.
Again, anything that works for someone in their normal life, they should translate to the COVID time.
Absolutely, absolutely. I love that gardening can be very therapeutic, also just to put your hands in the soil. And it also, I like that it gets you out of the stuffy house, you
Well,
know?
I was going to ask you about that. Part of her comment, though, is the idea that it's doing something positive for your property. So it's a good thing where you can say, "Hey, I accomplished something," and then yes, there's the angle that you talked of, the idea that you're outside. Being
Mhm.
outside, not looking at the same four walls, is probably a huge component here.
Absolutely, absolutely. So you want to make sure that you're doing things like that. And I like that because she's outside doing something that she loves, but also she's maintaining that social distancing. She's on her own property, and feeling good. So you want to make sure that you're doing things like that. I know someone that goes outside and kind of walks around their property, and they do that at least once a day to make sure that they're getting outside, that they're getting that fresh air. But this person also has anxiety. They feel better knowing, though, that they're in the safety of their own area and not
Mm.
out in a crowded area.
So that kind of connects back to the whole routine thing. Familiarity is therapeutic.
Yeah.
Did you have any clients out there that are really struggling with sort of the work family balance, the idea that lines are blurred?
Yeah.
I've been lucky. I've been lucky in the past couple weeks here. I'm still working in the office. And so when
Hmm.
I'm done at the day, I can get in the car, I drive, I decompress. By the time I'm home, I have separated works over here, homes over there. There's a
Hmm.
lot of people where the laptop is on the kitchen table and there is not that kind of separation whatsoever. Talk about the blurring of the lines.
Yeah, it's so difficult because we have, Let's say we have two people in the home. Let's say it's a husband and a wife, and they're working from home, and then they have their kids that are doing school from home.
Mm.
And so the whole family is there. And how do we create really enough workspaces as well? And then we have kids. Are they getting up? Are they coming into your space? It can be very stressful. Okay. So, I would say, and you'll see people doing this online, to try to make designated workspaces for yourselves or your children. You see some of the children and they may have one room, but they have their desks kind of turned in different ways, but they're sharing a space, but in that space they have their own space. Okay. And then do you and your partner have your own space? Because that's good as well, to make sure that we're kind of sectioning things off, whether you live in a larger house or you live in a smaller house, that everybody has their space and everybody knows what it is that they're supposed to be doing. Okay.
I've talked in the past to sleep medicine experts, and they talk a little bit about sleep hygiene. How once you're in bed, put away the screen. Make
Yeah.
sure that you prepare yourself to sleep, that you have a time when you shut it all off and you have a time when you turn it on.
Mm-hmm.
Evening routines are also important that way to make sure you're just not carrying it into the next hour and the next hour and the next hour.
Mm-hmm. So if you were already doing something in the evening, it's good to carry that on. Okay. So I tell people all the time, like you said, to turn off the electronics, to do things to wind down. That might be making a glass of not carbonated or caffeinated tea, or, warm water, making sure that if you're someone that gets hot, that you're wearing cool clothes and maybe you just have a light sheet, or if you tend to be cold, maybe you have a heated blanket like I do, but making sure that you're still doing those things at night that are going to get you off to sleep. See how we
We've got
don't.
a suggestion that just came in from Bree on Facebook. She says, shut off the TV and the screens and put on some uplifting music, whatever genre is your favorite. Have a dance party with the kids.
Oh, I love that. Yeah, and the dance party might wear them out too, so that they go to sleep after. Be a double. Yeah, yeah.
Right.
The Calm app is actually a great app as well. You could go on there and they have guided meditations that will.
Talk a little bit more about that. Is that I've seen some kind of like it. I don't know if this is the one you're talking about. That's kind of a timer. It tells you now you're supposed to be doing this, or now you have to have some quiet time. It orchestrates your day for you a little bit.
Well, yeah, there's so many different things that you could click on, but specifically the ones for sleep, some of the ones that I've used, they may start telling a story and then they get slower and slower and you're
Oh,
hanging on and then you're falling asleep. So things like that. Another good one that I love, it's Oprah and Deepak. They have a 21-day meditation right now and it's actually free and it's called Hope in Uncertain Times. That's really great to check out as well. But things like this listener is saying that you can do that will ease you into sleep, but also start to get that mind to wind down that is already still on that
yeah.
day and everything that has happened.
And I'm probably the last person in the world to tell people don't consume news. News is what I do.
Yeah,
But I imagine if you're on that device in the evening, you're not doing the Oprah or the Deepak thing.
yeah.
You're being inundated. Oh, I got an
Hmm.
alert from CNN just now. Oh, I got an alert from NBC just now. Oh, NPR just did this. Shut all that off.
Yeah, and it's so tempting if you love the news, like you said. There's just always something. And if you love to learn, this is definitely a time to be looking at all of that and you can click on one thing, it'll go to the next. But is that creating more of an anxious state? Or is that keeping you up and out of your routine? So I suggest, like everything else that we're talking about, that you schedule time to check in with the news, with the media, all of that, and you have time where you separate from that and that you unplug.
In
Mm-hmm.
all of this, there seems to be sort of an overriding theme: the idea of self care. Be
Yeah.
aware of what you need. Make sure you're taking care of yourself. Make sure you're realizing that you're important in all of this.
Yeah, yeah. You are so important. You have to really be kind to yourself. And people are handling things in different ways. There is this thing circulating on social media that says you need to get up, you need to get a skill, you need to do all this stuff during this time. And there was someone that kind of blew that out the water and said, you don't have to do anything. This is a traumatic experience. You can
Yeah.
just be. And I think it was very liberating to a lot of people. And so I'd say it could go either way. Some people need to give themselves permission to do nothing, to change their whole routine, to just be during this time and really just survive, go day to day. Other people need something in order to feel like themselves. They need something that they could be doing. So I'd say, allow yourself to have whatever routine works for you, but also allow other people to do what works for them. Just like when we see with any trauma, people are going to respond in different ways.
You kind of touched on this, but on Facebook, Bethany is asking about specific meditation apps. What ones do you like beyond Calm? You said CALMM.
Yeah,
.com.
I like the Calm app and the Oprah and Deepak. They have a 21-day guided meditation right now. It's free. It's called Hope and Uncertain Times. And if you click on that, it will take you to the actual free meditation. But there are a lot of different meditation tools, and you'd have to just go into your Play Store and look at those. Those are two that I can think of offhand. And sorry, I don't have more.
That's okay.
But there
What
are
we'll do at the
tons.
end of this is we'll add resources into the comments. So if there's something that we didn't get to here, you can let us know, and we'll make sure that we get it in the comment section underneath this. So we'll get all that.
Absolutely.
Headspace and Shine are two that I've heard are pretty good.
Right.
I don't know if those are
Right.
ones you know anything about.
Yeah, and I believe is Headspace, is that the one that's free right now?
It is. Yep,
They've made that available in New York State, I believe, for us all
that's
to
right.
be able to use. Yeah,
Yep.
thank you for saying that.
Bethany's just chiming in online with that. Talk a little bit about stress for teenagers, because I imagine they're in a different, to use the phrase, headspace to begin with.
Yeah, yeah. I really feel for teenagers because it has extremely changed everything for them. And I think we have to really get down to the mind of a child, of a young adult to really think about what they're going through. Their whole life is outside, their friends, learning, exploring, having a good time, going to school. And all of that stuff has turned off.
Yeah.
We've had our time to do those things. If this wasn't going on, a lot of us said, I wish I had a break. I wish I had some time. So I know we didn't wish this happened, but teenagers, they're not at that point. And so I'm seeing a lot of my teens when I call them for teletherapy or on the phone, or I call them on the live screen, they're calling in and picking up, and they're asleep. I can see on the screen that they're just waking up, pajamas on, head bonnet on. And I said, do you know what time it is? Are you woke? What's going on? And they're like, it's nothing to do. Are you depressed? No, miss, there's nothing to do. And so I'm developing things that they can do, lists that they can go to because they're bored.
I've read that in normal times, social media contributes to depression.
Yeah,
You end up comparing yourself to a lot of other people. You might not measure up to their expectations. Social media can be brutal. It can be cruel.
yeah.
But I'm wondering if, in this particular case, it's a way to get out beyond those four walls. It's a way maybe to
Hmm.
communicate with your friends. What's the good? What's the bad? Where's the balance there?
Yeah, there's always, one side or the other. So, like you said, it can be a lot of bad stuff, and you have to be mindful of that. You also have to check what your kids are doing online, monitor. But and what's going on right now, it's really good because we can stay connected to each other. For teens in particular, their whole world is on the social media.
Yeah.
I come up with a crisis plan sometimes for my teens that are going through depression. And I say, list some friends and their phone numbers that you can call. I don't know anybody's number. We just connect on Snapchat. And so you got to understand that that is their world. And I actually gave a teenager an assignment to go on TikTok. I don't even have a TikTok, but I know
Okay.
that everybody's doing the dances, and it got that teenager up and out of bed and making those, fun, silly videos. But we have to encourage them to do those things that are fun and safe that they normally do.
And at the same time, while they shouldn't necessarily stay in bed all day, I imagine you've probably given advice to parents that say, just cut them some slack.
Yeah.
Let them be, because this is not a normal time for them.
Yeah, absolutely. When you say that, I think about the schoolwork, and it can be very stressful for that kid. A lot of my teenagers are saying, Erin, I like to be in the classroom. I have a learning disability. There's not anybody that's able to read my assignments to me, and my heart breaks. We have to think about all these things and how life has changed. And so, where they might have been in class normally from 8 o'clock to 12 to lunchtime, can we break it up? Can we allow them to do what they can? They start getting groggy. We transition and let them do something else and then come back to it. But really, what I suggest to parents is that they really take it at their own pace. No one's expecting you to be a teacher, okay? And we're not expecting that student in this time to be this straight A, great student. Can we just get them engaged and doing some learning at certain times?
For kids, I think in a lot of ways, they kind of define themselves by school. For
Yeah.
adults, perhaps more so with their job. Talk
Hmm.
about not having that in your life, not only because in some ways it completes you, gives you something to do, etc., but financial stress. Where's my
Yeah.
next paycheck? What's going to happen? That can be a huge worry, I would imagine.
Yeah, it's huge. Financial stress is something that is not, I feel like, talked about as often. It is so linked with depression and anxiety. Okay. And so many people are in some real financial binds. And my heart is really with everybody. I can't stress enough we're in this together. But what I would, suggest is that you talk to, um, wherever it is that you live, if you're paying a rent or you're paying a mortgage, whatever your bills are, literally get a piece of paper and write everything down. I'm not saying right away, pace yourself. This is a stressful time, but it might be helpful to make that list, to put the phone numbers to the companies on that list, and then in your leisure to contact the different people. And here's why: people are really working with you during this time. They understand what's going on. And so I'm seeing companies that are pushing payments, that are allowing you to make different arrangements. But you have to actually just reach out.
And I
Hmm.
imagine too, the monster in the closet is scary. But if I put it down on that piece of paper, I start thinking about it. Hey, maybe I can make a call to the IRS, or I can maybe
Yeah,
make a call to the bank.
yeah,
It suddenly becomes less of a, oh gosh, I don't want to rip that closet door open. The monster's going to bite.
yeah.
It becomes less of an issue if you can just whittle away at it just a little bit.
It will, alleviate some stress. Let's say that you have a list of 5 bills, and then that day you contacted two, and you were able to make some type of arrangement for your payment, or maybe they took it off, and you were able to highlight that off or cross that off. That lifts something off of you.
Sure. Erin M. Moss is with us. She's with Erin M. Moss Private Practice. She's a mental health counselor. Every Thursday, we're going to do this. We're going to talk about mental health issues. Coming up next week, we might touch on, and in future weeks, seniors, isolation, PTSD. Right now, though, it's primarily anxiety and stress. If you're on Facebook joining us late, that's what we're doing right now. We'd love to have some of your comments and some of your questions for Erin. An
Mhm.
area that I wanted to get to, Erin, was the idea of first responders. I heard on the radio this morning, NPR had a story about a volunteer ambulance company that is seeing death regularly, or at least just involved in crisis more now than they ever were. Are you seeing
Yeah.
that in your practice? And what kind of advice would you have for those people?
Yeah. People in healthcare are really worried, and they're seeing things like you said. It's not that they haven't before, but It's in the masses. They're training for things, or that and actually putting those things to use that maybe they haven't actually thought about having to apply. And it's a lot. It really is a lot. And so again, I'm telling those individuals to be patient with themselves, to understand that this is normal, that they need to, when they get done with a long day of work and they take their scrubs off, that they need to immediately go to their support system, you know, even if it is just an online thing, because the people are not there in their home, and they need to make sure that they get what they need inside so they're able to tackle that day again. But it's a
And in
lot.
some ways, that support system you talked about could be us. There are things that we
Hmm.
can do. Um,
Hmm.
People are leaving baskets of flowers for nurses, that kind of stuff. What is the ideal way to approach someone and help them out?
Yeah. Well, the one thing that I'm hearing, and I know that I'm just repeating everybody, we need to make sure that we're doing our part. We need to be inside, you know and you see them asking everybody to stay inside so that we can make sure that everyone is safe, and we're cutting down on the amount of people that are coming to the hospital, overwhelming the hospital system. So I will say that as number one.
Okay.
Also, you want to check in on your friends that are in healthcare: doctors, nurses, hospital staff, receptionists, making sure that they're okay. Is there anything that you want to talk about? Is there anything that you need? I love a good handwritten note. I know we communicate like
Yeah.
this, but you rarely get a piece of mail with your name on it with a nice little
Yeah.
note. And so, things like that, little things that show appreciation. There are a number of people that are making masks. Can you donate some of those masks to
Mm.
hospitals? Or goods where your restaurant or service is closed, and maybe you have access or the ability to donate some of that stuff that could brighten up someone's day.
Another group of people that we haven't touched on much, and again, it will be a topic for another one of these Thursday conversations down the road. But tell me a little bit about seniors, shut-ins, isolation.
Yeah, it's really tough because there are a lot of seniors that are shut in their actual home, and a lot that are in nursing facilities, senior facilities, and they're not able to have family members and friends that are able to come in, and it's devastating right now, you
Yeah.
know yeah. And so my suggestion would be for those individuals to make sure that they're staying connected to their family members, and specifically for those family members, whether you had regularly been going to the facility, if your loved one is in a nursing facility, um, to contact them,
Yeah.
to make sure that they're okay, to sit on the phone, to listen to the stories, and again, some of that same advice of a handwritten note. I know people that have dropped off things. So even though they can't go inside to see their loved one, they're dropping things off. And you have to check with the facility to see that that's okay. But making sure that you're still maintaining that connection with your loved one.
And phone calls. I mean, that's obviously part of the process. They don't have that social media thing going, but even if you're just on the phone saying yeah, yeah, and listening, I imagine that's
Yeah.
good.
Sometimes
Yeah,
that's all we need.
I think we have the same mother. let, let, yeah, okay, I
Yeah.
hear you. Talk a little bit about other resources. I know that you have worked a lot with EAP programs, employee assistance programs that workplaces have. Certainly, that's a resource people can tap into. Talk a little bit about that, and then we'll get into other resources you might have.
Yeah, absolutely. Well, I have a contract with Wegmans EAP, and it's through Empathia, but it's known as Wegmans EAP. That's what everybody says that works there. And really, EAP is an employee assistance program. Most employers have an EAP program, and they actually pay for you to see a counselor. Okay, and so Wegmans is really great. They give usually quite a bit of sessions that
Hmm.
last for well over a month, and that would be very helpful for someone that still has to go to work, that's an essential employee, to have somebody that they can connect to after their shifts to
And
help them through.
even though it's connected through the employer, if I whisper in Erin Moss's ear, the boss isn't going to know what I talked about, right?
Absolutely. It's totally confidential. The EAP group serves as that go-between. And so I, or whoever it is that you select as your counselor, would never actually talk to your employer. In fact, we're actually instructed not to. Okay? Yeah. I also have an EAP contract with ESI, and they're the EAP for places like Kaleida Health, so a lot of the healthcare workers. But wherever you work, you want to be asking about EAP plans.
If I'm someone who does not have an EAP program, or if I have someone in my life who I see is struggling, to my mind, the biggest obstacle is maybe, and I don't want this to be a commercial per se, but to reach out to an Erin Moss, to try and get that extra help. How do you climb that hill? How do you get someone to say, yeah, maybe I do need this, or maybe it's time to talk to Erin or the
Yeah.
EAP program or whatever?
Yeah. Well, I honestly feel that everybody needs somebody to talk to, and I'm not just saying that because I'm a counselor. You know,
Yeah.
when you think about hard things that happen in your life, I'm sure we can all come up with something. It really benefited us to have someone there that we can talk to. And counseling is essentially that. I think we make it way more than what it is. And it's someone there to listen, someone there to validate your thoughts and feelings. It's there really if you need. We've talked, Dave, in the past a lot about busting up the stigma. Okay? And I'm just going to touch on that briefly. Just like we need to take care of our physical health and exercise and things during this time and put the masks on, we need to take care of our mental health as well. I used the word trauma a lot in this. You know, this is very traumatic what we're going through collectively, you know, in so many different ways. And when you think about it like that, it's very beneficial to have somewhere that you can go and talk that's not biased, that's confidential, where you could just throw up your thoughts and feelings and go on with your life.
All right. That might be the best place of all to leave it, unless there's any closing thoughts that you had that you really needed to get out. And again, there is a reminder, we will be gathering resources and putting them below the page here on Facebook. But closing thoughts, Erin Moss.
Yeah, well, I'm just so thankful that I was able to be on this program with you, Dave, with WBFO. It's just amazing, you know, that you guys are providing weekly check-ins really during this time.
Yeah.
And I'm happy to be here. And, you know, even though all of this stuff is going on, I want everybody to remember there are still things to be grateful for. There are still things to get up in the morning, you know, and have a sense of worth for. And I want you to really try hard each day to look for what that is, because that may just be the thing that keeps you going. And we
All
will
right,
get through
Erin,
this.
thanks so much for doing this. This was great. I really enjoyed it. I hope the folks that joined us along the way got a lot out of it too. Thank you.
Thank you.
And I'd also like to thank the folks that did join us along the way. Behind the scenes, I've got to say thank you to Lynn Bader and Johnny Moran, people that really pulled this program together. And let's look ahead to next Thursday. We'll do this again. We're going to talk next Thursday about one of the topics you had, Erin, trauma and PTSD. It's really part of an ongoing conversation here. The first in our series, Mental Health During COVID-19. It's part of the WBFO Mental Health Initiative with support from the Patrick P. Lee Foundation. I'm Dave Debo. We'll see you next week. Thursdays at 4. Mark it down. It's a date. Thank you.